because you will never guess what happened today. So as you can see, this is not Rosie. This is a 3-pound tiny little puppy.
Have fun with Rosie.
Hey everyone, this is a week in our lives, Viral and Amanda. Viral actually went home for the week, so we're kind of living in our own little bubbles for a week. And, you know, gonna miss them, Rosie and I, but you know what it means. Just kidding, I'll probably just do a bunch of studying. Maybe not studying, but like research papers, getting everything in for the deadline of our residency applications, that type of thing. Probably watch a bunch of Netflix, the shows that Viral doesn't really like to watch. I think I'm gonna surprise him by the end of the week when he comes back because our anniversary is coming up soon and we're gonna go on a little weekend getaway, but I think I wanna put like balloons and his favorite foods in his room when he gets back and be all cute. Tuesday, everyone. I'm on my 3rd week of my 2nd derm rotation and I'm loving it. Now I'm doing more of Mohs, which is a surgical procedure for cancers. Well, I was supposed to just watch some cool nail procedure that was going to be done, but I have a meeting with some researchers that it's kind of a long overdue meeting, honestly. We have some papers we're hoping to publish before residency applications, but that might not happen, so who knows what this is going to be like. My research conference meeting is about to start, but in the meantime, I wanted to actually talk to you guys about Mohs a little better because I felt like it was a little rushed earlier. So this month, my dermatology rotation is more focused on Mohs micrographic surgery. What that is usually for patients who have either basal cell, a squamous cell, or a melanoma, those type of cancers on the skin. If they have them maybe on the face or on certain areas on the arms or really like back, extremities, anything that if the doctor who kind of referred that patient to the Mohs surgeon thinks that there's any kind of squirrely or suspicious features, that could mean that if you just excise that lesion once, you might be missing some of those cancer cells. So what they'll do is they refer to Mohs surgery, and a Mohs surgeon takes like each layer one by one. So you start off by kind of what you see, you stay a little like more superficial and you make this bevel type cut, and then it gets processed. So the tissue will become flattened and they'll slice it in a different way than they would normally slice it in a regular excision. Because basically anytime you take out a skin cancer, it goes to pathology for them to read and make sure that you've got it all or this is exactly what it was. But in this situation, they take very thin slices and they're horizontal slices. So usually excisions, when they're sent for pathology, they call it bread loafing because they'll go up and down and those are the slices they look at under the microscope. But in Mohs, they take horizontal slices so that when the doctor looks under the microscope, they can see every aspect of where those tumor cells could be. So they make sure that there's none hiding and they'll keep going back to the patient and taking small little layers every time and then go looking under the microscope. So you do that back and forth until you know that the tumor's completely gone. In this way, there's a really high cure rate of these cancers, plus they can take smaller margins so that the scars don't end up being as large. And then another great thing about Mohs is that these surgeons are trained to do kind of complex repairs, especially because a lot of Mohs surgery happens on the face. And so sometimes there's flaps that occur where it was really cool. I saw this patient who they took his forehead and they kind of swung it around and put it on his nose. Like, I don't know, I've never seen that before. That was a flap. And then a graft would be something like where they take a piece of your skin, let's say from your neck area, and they'll put it on your nose or on your cheek because there isn't enough skin in the area for them to pull it closed well. All of these post-op patients that I've seen, you can barely see their scars, so it heals really beautifully. Guys, you will never guess what happened today. So as you can see, this is not Rosie. This is a 3-pound tiny little puppy that when I went to PetSmart to get my Rosie girl, a lady handed her to me. Like I was saying, I basically went to get Rosie her vaccine today, and as I'm walking in to go pick her up, a lady comes up to me and says, "Do you want this 9-week-old puppy?" And I was like, "What do you mean?" She said that the mom of these puppies had the litter and then the family moved or something and abandoned the litter. And so someone was trying to find them homes. They gave the dog to this couple who could not take care of this puppy because of their landlord, and it seemed like maybe some other issues as well. So I got suckered in. I mean, it's the cutest little thing. And so I brought it into the vet and I got it its little shots and everything it needed. And it's just so adorable, guys. Oh my gosh. Yeah, so it was healthy, they said. So one of my friends is going to help me adopt this puppy because I can't keep her right now since I'm working every day. But I wish I could. Oh, she's so cute. You're okay, little one. Yeah, so now I'm gonna just take care of her for the rest of the afternoon. Look at your face. It's so adorable. I'm in love. I want one. I want her. If only I could keep her. And Viral's not even here this week, so I'm trying to do all this by myself. Oh my God, so much.
Now that we have our own YouTube channel, I've been watching a lot of YouTube and I feel like everybody has a monitor on their desk setup. So I had this monitor kind of at home in my parents' place because there's a desktop computer that I have, and I actually have a double monitor, and this is a new one that we recently got. But I figured why not just bring it to our place and use it. Hey guys, so I'm on my food as medicine elective, and we learn about how to optimize diets to get the best health and wellness we can for ourselves as medical students and also for patients as well. It's a virtual class, so I've been given a little bit more free time, so I came home to my parents' place, get some good Indian food. So I'm actually gonna head back soon, and I'm really excited because I really want to meet this puppy. From what I understand, she was at PetSmart getting Rosie her updated vaccines, and somebody literally just handed her a puppy. So she got the puppy back. There were a few people in our neighborhood that were able to look after her, and apparently Amanda found somebody to take the puppy and adopt it today. My mom made me a whole bunch of food, so I gotta pack all that up and we'll be on our way. Alright guys, I'm packed up, ready to go. Something I did over this time I was at home is actually remove the center vinyl stripes that I had on my car. Now my car looks super plain, but those vinyl stripes were pretty beat up from the sun and whatnot, and I figured I'd go ahead and take them out now before they started actually cracking, and then it would have been very hard to take off. So got a pretty plain car right now. Alright guys, so I'm finally home. I got a lot of things to unpack from the car, but first I gotta go see Rosie. So this is actually the first time I've ever even left her for a few days, so this will be interesting to see how she reacts, and let's try to get it on camera. What have you done here though? You made a mess! Oh no! Hello, Papa! Hey, baby. Hi. Lights on. Oh my goodness. A card and all these goodies. I thought we were supposed to be on a diet.